if you are someone who wants to join a group that is very vibrant, I think this is the program for you. My name is Oladi Bento. I'm the program director for the Neurocritical Care Fellowship at the University of Minnesota. We had a unique program in the sense that we actually work very closely with the Vascular Neurology Fellowship. The one thing that differs from this program compared to other programs is that collaboration that we have with the vascular neurology. Our fellows get to do about 2 months of vascular neurology. So when you come out of this program, not only you'll be able to take care of neurocritical care patient, but you should be able to manage acute vascular cases as well. We have a set of didactics and that we offer weekly to our fellows. Most of our didactics happen, again, we have Tuesday conference, and we have Thursday neurology conference, and we also have ground rounds. These are programs led by the fellows. So the fellows present all these cases that they saw during the last month or the last few weeks of the rotations. So the fellows go through a rigorous training program throughout the year. The first week, we do have a boot camp. And during that boot camp, we talked about several aspects of the program. Both it's a combined boot camp with the vascular neurology program. We talked about, again, how do you manage an acute stroke? How do you triage a neurological emergency in the ICUs? And then one of the days for the boot camp is dedicated solely to clinical research. How do you run a clinical trial? What do you do? What's a clinical equipoise? So we go through all of these things during those specific dates. And the fellows get to actually present some of their research work as well at the end of the year, our ground round. The telemedicine program, we instituted this about a little over 2 years now. When someone shows up in the emergency room for any acute neurological issues, so the stroke program is the first line to assess those patients, make a determination whether this is, again, which route are we going? Are we going to the route of acute ischemic stroke, or is it a hemorrhage? Is it subarachnoid hemorrhage? So our fellows are actually trained on how to actually manage those patients acutely. It can be in-house or you can do it remotely via telemedicine. So they can actually do all of those things, taking calls from home. And we also cover other smaller hospitals around the metro area, including Fairview Lakes, Northlands, Regis hospitals. And the way we also assess those patients, we see them remotely via tele-stroke. Especially in the era of COVID, when there's a bed crunch. Last year, for example, we managed there was a lot of patients that we actually saw remotely without having to transfer them to university or software because there just wasn't any bed available. So I think this is the strength of the program. By the time you finish your fellowship here, either with the vascular or the neurocritical fellowship, you will be equipped to deal with anything that can come towards you, either locally at your own hospital, or how to actually triage those patients at specific other hospitals, and then evaluate them, come up with a plan, show them the images, and do a complete stroke neurological workup. Our program is small. Right now we have three, at least from the ICU standpoint, we have 3 faculties. They are trained and board in neurocritical care. And then we have 4 faculties in stroke neurology. So we do have a very strong collaboration with all our fellows in terms of meeting outside of the hospital. If it is a happy hour that we go to, we do that. If there is a holiday party, we do that. If there's a picnic at someone's house, we often have those activities. You will be learning a lot, there's no doubt about it. It is a heavy program in terms of a clinical, and you take those skills with you wherever you go. Right now, we are the top enrollers in at least 3 or 4 clinical trials, national clinical trials. I happen to be the PI for one of them as well. So we get to be invited and nationally talk to other folks around the country about what is specific about our program and what we're actually doing, and how can we help the other programs in the nation achieve what have been done here in Minnesota.